Hey everybody, how you doing? Last week we were in Uganda. Today we are in Kenya, and last week we were talking about depression, but today we are talking about trauma, and we have an amazing guest. You do not want to know. Amazing. He's a psychologist and he's going to help you with some tips, some information, especially when you have faced some small trauma or some big trauma, regardless of the spectrum. We want to promise you that you're going to have some amazing content. So today, if you want to be the one doing the interview, yay! And I'll be the one behind that camera. So relax, enjoy, and get educated. Hello, Binguni. Hello, Binguni.
Hi, amazing people. Hi. It's another good day, fantastic day, and we are back again, Chalaf Productions, and we bring you an amazing guest today. And what we're gonna be handling today is trauma. Yeah, trauma. So sit back, relax, and enjoy this show. It's gonna be fantastic. We have an amazing guest here. He is so amazing, so fantastic.
Yeah.
So, yes, our guest today, can you tell us who you are? You tell us your name and what you do.
Yeah, my name is Michael Mwala Mtengo, counseling psychologist, and I thank God today I'm here. Most of the time I do counseling. I operate the private firm doing counseling to people, various disorders. So that's what I'm doing. Yeah.
Welcome to our today's show.
Thank you.
We are blessed to have you. So as we said earlier that we are doing trauma today, and we have this amazing brother, amazing guest here with us. So as we begin, you can just in simpler terms tell us what trauma is.
Yeah, trauma is a psychological distress caused by traumatic events. So the moment you are exposed to traumatic events, horrible events, that's the time now you can develop trauma. But trauma is very wide. That's why we have what we call traumatic stress related disorders. So when you talk about trauma, most of the time people who are suffering from trauma, they suffer from what we call post-traumatic stress disorder. But there must be traumatic events. There must be some events that have happened to your life that are very traumatic, stressful, and they cause you to have the psychological distress. Yeah.
Amazing. So you can just tell us examples of these events.
Yeah.
That can cause trauma.
Yeah. These events, one of them can be accidents, sexual abuse, physical abuse, family violence, maybe exposed to the death of your close friends or relatives, or witnessing robbery. All those terrifying events, those are the things that can cause trauma. Yeah.
Yeah, so alafu maybe kuna huyu mtu ako pale hajui kama kuna trauma ama hana.
Yeah.
So what are these triggers, or how can someone know that he or she is traumatized?
Yeah. Sometimes it's very difficult to know whether you are traumatized or not, because when you talk about the trauma, trauma is that being exposed to traumatic event. But now for you to be diagnosed on the issues of trauma, there must be a criteria, and this criteria is obtained from the DSM-5. As psychologists, we are using that diagnosis method, DSM-5. So first of all, for us to be able to discover whether you have a trauma, first of all we have to know whether you are exposed in any traumatic event. That is the first thing. That's the first thing, whether you're exposed at any traumatic event. And also, after we have realized that, the second thing we have to discover whether you have what we call flashbacks. What happened? Kile kitu ambacho kilitendeka, je, kinajirudia tena? katika mawazo yako. Maybe umekaa unaona kwa inajirudia, inakuja tena. Maybe ulipoteza mtu wako, maybe uliporwa, maybe ulikuwa abused sexually, inajirudia. Those are the criteria. That's the second thing that we have to look. The third thing ni kwamba tuangalie kama do you experiencing dreams relating to that traumatic event. Lazima tuangalie pia kama kuna dreams. Unaweza kuwa unalala unaota maybe ukifanywa kile kitendo, maybe ulifanyiwa, ama kile kitendo ambacho ulikiona. There must be those dreams. And then another thing that we have to see is je, kuna this is what we call recurrent of those things. Maybe unaweza kuwa unatembea hivi na nikana kwamba it's not real but inajionyesha. It's like you are seeing what happened, and sometime now it makes you even to shout. The other thing is that hiyo itatujulisha kuwa uko na trauma. Ni ile kuwa maybe unaona ya kwamba wale watu, kwa mfano ulikuwa raped, so unaanza ku develop hiyo avoidance. Hutaki kuona mwanaume mbele yako. Ukimwona unakimbia, unaogopa. Or maybe you are abused by your father, so the moment unaona mtu amefanana na babako, you develop that issue. You start being terrified and being tensed and having psychological distress. And also kama ni mtu ambaye hutaki, ukiona kitu kinafanana, kwa mfano ulipata ajali ama uli witness ajali na uone gari ambayo inafanana na kile kitu kilitendeka, now unaanza kutense ama unaanza ku develop psychological distress. Or una hate. The other thing, una hate, for example, those people who are sexually abused. They start developing that negative thoughts concerning themselves, and they say that mimi siwezi trust mwanaume tena. Mwanaume na mimi hakuna mwanaume mzuri, and they hate wanaume, or they have that avoidance. So unaweza kuona mtu anasema mimi siwezi olewa, mimi siwezi date, something like that, because maybe she was sexually abused, and now I can develop that negative thoughts towards men. Sometimes also unaanza kujiblame wewe mwenyewe, and you say that I'm worthless, I'm a bad person. You develop that self-blaming. So those are the things that you can say this person has trauma. But you have to be very careful, because you have said that stress traumatic related disorders ni mingi sana. So for us as psychologists to differentiate it with other disorders relating to stress, now those symptoms has to appear more than 1 month. That's the time now we can say this is trauma, post-traumatic stress disorder. It must the symptoms must have more than 1 month. Lazima iende more than 1 month. Yeah.
Wow. Trauma inakaa kitu big sana.
Yeah, ni kitu big sana.
Na ni kitu yenye ina affect watu wengi, hasa the young people.
Yeah.
People are exposed into different types of things that really traumatize them.
Yeah.
So maybe kuna huyu mtu traumatized. No, as a sociologist, as a counselor, how can you advise, or what is the process of healing someone who is traumatized?
Yeah, the process of healing, the good thing, because trauma is a post-traumatic stress disorder is a disease, is a psychological disease. And for you to heal from trauma, there are so many interventions that you can use. But the first thing is to get assistance from a registered counseling psychologist. Because that's the time now the psychologist will help you to unleash what is hidden in the unconscious part of your mind. Because when you talk about the flashbacks or dreams, these are the things, these are threatening thoughts ambazo zimeekwa kwa part of your mind that you cannot remember. So the moment ukikaa hivi zinajileta kwa conscious na zinakusumbua. So you need a counseling psychologist who can help you to talk, who can help you to unleash those threatening thoughts from your unconscious part of your mind na zije kwa reality so that you can deal with them. Or that is the first thing. The second thing, that if the counseling psychologist see that maybe there are symptoms that has to be addressed, that counseling psychologist will refer you to a psychiatrist for drug therapy. But what can help somebody who is traumatized is to get somebody who can talk with and to share. But this person, not just a person, but a qualified therapist who will make him or her to share whatever is going on. Because sometimes also you can get somebody to talk to you na akuletee mashida zaidi, because ataanza kukujaji, ataanza kukuletea mashida zaidi. So what I can advise young people, the moment you see those things, you have to see or to seek help from a qualified counseling psychologist. Yeah.
Wow. So unamaanisha trauma it's like a disease.
It's a disease.
You really need to seek a doctor.
Yeah.
For example, mtu akona shida ya macho.
Yeah.
Hawezi endea daktari tu hivi.
Hawezi endea daktari.
Atafute daktari wa macho.
Yeah.
Sasa kuna huyu mtu maybe ajui anatoa wapi watu the specialists in that area, the counselors.
Yeah.
There is this young person who is really traumatized na hajui anatoa wapi counsel.
Na si kwamba eti hata hajui anatoa wapi counsel. Hata hajui kuwa ako traumatized. Acha nikwambie, these things happens. Sometimes unaona mtu hata ukimuuliza kwa nini unasema kuwa mimi sitaolewa tena, anasema tu sitaolewa tena, anakuambia tu ni hivyo, na hata yeye mwenyewe hajui. Sometimes unaona mtu anakuambia kuwa mimi naogopa naogopa kutembea kwa njia, na hata ukimuuliza kwa nini unaogopa hajui, because these are the things that really happen kitambo. So the first thing, whatever we are doing here, this what now is going to make that person discover whether whatever is going on in his life or her life is trauma. So from there now, the best thing is to seek for help. Seeking for help now is to get a counseling psychologist, somebody who is qualified, not just a person. Trauma is not like any other psychological disorder. Like the issue of drug abuse, people can come and talk to you and all that. But the issue of trauma, I can come and talk to you, but if I'm not very careful, nikakuongezea mashida tena. So in the county government we have counselors, in the hospital we have counselors, in the government hospitals we have counselors, whereby the services are a bit cheap, a bit free there. So it's good to go there. Even also, the reason why I want them to go to counseling psychologist who is qualified, so that he can get the right diagnosis. Because we can say that this is trauma, kumbe ni acute depression. So ukipata tu mtu aje akuongeleshe, okay atakuongelesha, but at the end of the day maybe anaweza kusababisha mashida zaidi. But also in the church also, the moment you get friends, maybe you have friends, and now the problem, I have come to discover that people need help, but watu wa kuwasaidia hawako. Because today people are so judgmental. So many people are suffering from trauma. They have no confidence to approach you as a friend and talk about what is disturbing them, because they think that you are going to expose them or you are going to judge them. So watu wanakufia tu na mashida zao. But the best thing, if you have somebody whom you can trust with your information, it's good also to share. If you think that I fear this, for example, many traumatic issues that I have seen, those people fear to date, fear to do sexual things because of what happened many years ago, and even they can't remember. But inside them, they say that I can't trust a man. Like somebody who has undergone divorce, she said that I can't trust a man at all. And you ask her why. No, men are very bad. So they have to get somebody ambaye anaweza kumtrust, and the moment akisema kwa nini utrust mwanaume, at least mkiongea inaweza kumsaidia. But the best thing is to get a registered and qualified psychologist.
Well, now the last question.
Yeah.
After now you have talked about the church.
Yeah.
What is the place of the church in the issue of trauma? How can the church be of help now that we have said that you have said that it's rare to find someone who will be there to listen to you.
Yeah.
And
it's rare.
The church is an important
it's true.
place.
Yeah.
And there's this young person.
Yeah.
What is the role of the church in dealing with this issue of trauma?
Yeah, the church plays a very big role. The problem that we are experiencing today is that, okay, some churches have embraced the issue of mental health. Some, they have not yet embraced the issue of mental health. And that is the challenge that we are facing today, even as psychologists, whereby you get somebody and you see this person has a schizophrenia, is another type of disease. He has a certain disease, maybe trauma and all that, because the moment you have trauma, sometimes also you develop what we call hallucination. Hallucinations whereby you hear some sounds and you are in the church. So as a psychologist, you know, when you see those things, somebody's talking that I have heard this sound and this and this and this, you may see this person, maybe these are the symptoms of a person having trauma. But now the church, because of the spirituality way of understanding things, maybe the church will call for deliverance. And now the problem is that the church has not fully embraced the issue of mental health. But if it will be good and if it will be wise, the church has to start embracing the issue of mental health and train some of the members, not just to go for basic counseling course, but to go deep and develop a department of counseling, a full department of counseling, whereby it's very equipped. The person who is working there is qualified, and from there now we are going to help the people who are suffering from mental disorders or mental problems.
Well, the church.
The church.
The church. Interesting. Yeah. So I hope church wamesikia.
Yeah.
By the way, young people, we talking about young people. I'm a young person.
Yeah.
And there are many things young people go through.
Yeah.
Many of us are in churches, and we expect the church to be the first place where we can get help.
Yeah.
Unajua kitambo utafute counseling.
Yeah. Umefika mbali.
Thought ya mtu ya mwenye ako church ya kwanza ni help itoke church. So kama vile our counselor ametuambia, churches, by the way, let us do this. Let us embrace this issue of mental health, because wase yangu wanateseka sana hapa hivi. And
one thing people, they don't understand, one thing on the issues of mental disorders, especially the issue of trauma. Whatever you see, maybe uone kijana ameacha church, ameenda kuanza kukunywa pombe, ameanza kuvuta drugs, ameanza maybe anafikiria kuhusu kujinyonga, maybe amejiingiza hivi kwa sexual immorality. All these drugs, the issue of alcohol, the issue of suicidal thoughts, the issue of sexual immorality, all these are the symptoms of something which maybe you have not discovered, maybe trauma. Because the moment you suffer from trauma, sometimes you develop a self-destructive behavior. You start isolating yourself. First, maybe you used to be a very active church member, praise and worship, a very active youth. But maybe things have happened in your life, and you have developed the issue of trauma. Now you start isolating yourself. Now you apply what we call self-medication through now drugs. And from there now you become drug addict. So these are trauma. It causes so many things, whereby if you are not very careful, you are going to treat the symptoms and leave the real thing, which is the trauma. That's why I've told you that the church has a very big role to play, but it has to embrace the mental health issues and be able to train its members, and also to call these mental health experts to come and create awareness, because some people, they suffer from this but they are not aware. They think that these are just things which are happening, and they keep on praying. But why God allowed people to do psychology? Yeah, so the church has to embrace and welcome the experts on the issues of mental to come and create awareness, so that when somebody has a problem, he can know that this is a problem and be able to seek for help. Yeah.
Interesting. Wow. Kwa hiyo, yeah, church. So finally,
Yeah.
what advice can you give to this young person who is traumatized when young?
Yeah.
Like, ni neno gani utamwambia?
Mi kitu naweza kuambia ni kwamba huwezi kuavoid hizi vitu, kwa sababu sometimes zikihappen kama kitu maybe breakups. Najua young people sometimes wanapitia hizo challenge. Hizi ni vitu zina happen, you are not expecting. That's why they are causing the psychological distress, because whatever happens while you are expecting, you can manage. The issue of death of your beloved person, maybe the issue of accidents, the issue of violence, these are the things that you cannot expect. But the moment you experience this issue, please don't usikae tu peke yako. Please try your best to share with somebody else and seek help from friends. Maybe you may not see a counseling psychologist, because currently we are very expensive. But even in the church setup, seek God. There's one thing that you have to understand, that even if we have a counseling psychologist, but there's God. The moment you meditate with the word of God, God himself is going to intervene. Trauma is a serious thing, but the moment you get God, you see God, you be close with God, and you talk to God, God is going to help you to overcome some of these challenges. And maybe sometime God also will touch somebody somewhere to come and help you, or may show you the person that can help you. But don't shy away from talking. Please make sure that you share whatever is eating you, because if you don't share, if you carry it, it will overwhelm you and it will destroy you. You will be stagnated. You will not make progress in life. If you are young and you are abused sexually and you are traumatized, you may not develop to another stage of getting married, because you fear getting to the same problem. But doesn't mean that whatever happened, it will happen again. So please don't think as if whatever happened to your life, it will happen again. It just happened, and it may not happen again, and we have God. That's what I can tell the young people today.
Wow. Hata kama serikali imepandisha bei ya kuoana, kwa hivyo uko pale, uko traumatized, maze usinyamazie.
Usinyamazie.
Talk to people.
Yeah, talk to people.
People are there.
Yeah.
I believe that there are people who can listen to us as young people and can help us out. Kwa hivyo usikufe peke yako, seek help and mambo itakuwa best.
Yeah.
Ama namna gani? Thank you so much. Thank you so much.
Yeah.